Hello everybody, this is Dr. Chow here from Atlas Vet. So today we're going to talk about a particular condition called ringworm. So ringworm actually is not caused by a worm. There's a common misconception. Ringworm is actually a type of fungus and it can cause a fungus infection, which is also called ringworm infection. So it's a common skin issue that can happen to our community cats and even cats at home. What happens is that the fungus itself is commonly found in the environment. It can be commonly found in soil, the grass, or other places. And then when the cat is exposed to the ringworm fungus, sometimes, not always, it can cause an active infection. What happens is that when a cat is exposed to the ringworm fungus, sometimes it can cause an infection. It doesn't always happen. It really depends on how much of the fungal spores is present in the environment and also the immunity status of the animal. And then when the infection happens, some common symptoms that we see is fur loss, itchy skin, and also bald patches on the cat's body. And one of the common things we see is those like circle skin patches that where the name ringworm comes from. And the next thing is important to share is that ringworm unfortunately can also spread to humans. So let's say if your cat actually has ringworm, you need to be careful that you don't get the infection yourself. There's a few ways for us to diagnose ringworm. So the first thing is, for example, this UV light. 50% of the ringworm species actually lights up under UV. Another 50% actually doesn't. So what this means is that if you shine a UV light on the cat and you actually see fluorescent specks, then we can highly suspect a ringworm infection. But then when there's no fluorescence, we are unable to completely rule out ringworm because it may be the other 50% that doesn't light up under UV light. So what happens is then usually what we do is then we will collect fur sample from the cat and then put them in a fungal culture like this, and then usually we will wait a few days for the fungus to grow if they are present. So this test commonly can take between 4 to 7 days depending on the brand of the fungal culture. So if it's a positive culture, commonly we'll see the fungus grow, and then the next step is taking some samples and checking under the microscope to see what species of the fungus, what type of ringworm is causing the infection. What is the consequences if we don't treat a ringworm infection? So what happens is that when we talk about the symptoms of ringworm infection is fur loss and itchiness and bald patches. So what happens is the bald patches will continue to grow, and then in some cats what you actually see is start to see black pigmentation of the skin spreading around the body. The most drastic outcome is then complete fur loss from the cat, and then sometimes because it is so itchy, the cat keeps scratching, and then what you start to see is open wounds. We have seen some cats where there's so many open wounds that you can see is just blood oozing out from all those areas because the cat cannot help himself or herself, it just keeps scratching. And then all these serious infection can actually deteriorate until we see a bacteria also causing another infection. So then what happens is a primary fungal infection and then a secondary bacterial infection. So it can really get quite severe treating the ringworm infection. So most commonly we do a multi therapy approach. So the first one is antifungal tablets or liquid medication, and the next thing is also topical medication. So most commonly what we use is a medicated shampoo. In humans we actually use antifungal cream to apply on the bald skin patch, but then for cats, because the ringworm infection commonly affects the whole body, it is nearly impossible to cover the whole cat in antifungal cream. So the more convenient method is actually using the antifungal shampoo. Usually this will be done 1 to 2 times a week, and then it's important to foam foam out the shampoo, rub it on the cat, and then leave the foam there to sit for 10 to 15 minutes for the shampoo to kick in and kill the fungus. The advantage of the shampoo is that you also help to kill the fungus spores. So you think about it, a fungus is essentially, you think about mushrooms, right? The mushrooms grow or spread by spreading the spores. Same to the ringworm fungus. So the ringworm will produce all these spores to release into the environment, and what this causes is that the spores can cause infection to other cats, or the spores can actually cause a reinfection. So basically, sometimes some cats actually recover from ringworm, but then they get into contact with these spores in the environment and then cause a second ringworm infection. So the fungal spores is killed by using this medicated shampoo. And then the third thing about treating is treating the environment. So like I mentioned earlier, a lot of these spores commonly end up in the environment, on the carpet, underneath the cupboard, all these things. So we commonly use specific disinfectant to treat the environment, to kill all these spores, to prevent reinfection of the fungus. A commonly used disinfectant is actually bleach, but then it's important that you need to do it at a specific dilution. The common dilution formula is 10% to kill the fungal spores hiding in the home environment. Then the next step is actually, after finishing the antifungal therapy, we pluck some fur again to test and make sure that the cat has completely recovered from the ringworm infection. The main thing is, why we do this is so that at least we know for sure that the cat has completely recovered. Because sometimes, even though we see with our naked eye that the fur has started to grow back, but actually there are still some spores hiding there. That's it for us. Thank you for watching.